silent threat, unmasking the reality of lung cancer. Do you know what lung cancer actually is? Lung cancer is a type of cancer that originates in the lungs. It is one of the most common types of cancer worldwide and is a leading cause of cancer-related deaths. There are two main types of lung cancer. 1. Non-small cell lung cancer, NSCLC. This is the most common type of lung cancer, accounting for about 85% of all cases. NSCLC can be further divided into subtypes, including adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. 2. Small cell lung cancer, SCLC. This type of lung cancer accounts for about 10 to 15% of all cases. It tends to grow and spread more quickly than NSCLC and is often associated with a history of smoking. Risk factors for lung cancer include smoking. Tobacco smoking is the leading cause of lung cancer. Both active smoking and exposure to secondhand smoke can increase the risk. Exposure to carcinogens. Occupational exposure to carcinogens, such as asbestos, radon, arsenic, and certain chemicals can increase the risk of lung cancer. Family history. A family history of lung cancer may increase an individual's risk. Air pollution. Exposure to outdoor air pollution and indoor pollutants, such as radon gas, may contribute to lung cancer risk. Radiation therapy. Previous radiation therapy to the chest for other medical conditions can increase the risk of developing lung cancer. Symptoms of lung cancer may include persistent cough, chest pain, shortness of breath, wheezing, coughing up blood, fatigue, unexplained weight loss, and recurrent respiratory infections. Diagnosis of lung cancer typically involves imaging tests such as chest X-rays, Connecticut scans, or PET scans, as well as biopsy procedures to examine tissue samples for cancer cells. Treatment options for lung cancer depend on the type and stage of the disease, but may include surgery, chemotherapy, radiation therapy, targeted therapy, immunotherapy, or a combination of these approaches. Early detection and prompt treatment are essential for improving outcomes and survival rates for individuals diagnosed with lung cancer. Do's and don'ts for individuals either at risk for lung cancer or diagnosed with lung cancer. Do's: quit smoking. If you smoke, quitting is the single most important thing you can do to reduce your risk of developing lung cancer and other smoking-related diseases. Seek support from healthcare professionals, smoking cessation programs, or support groups if needed. Avoid exposure to secondhand smoke. Limit your exposure to secondhand smoke as much as possible, as it can also increase the risk of lung cancer. Follow a healthy lifestyle. Eat a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. Regular physical activity can also help maintain overall health and may reduce the risk of cancer. Stay informed. Educate yourself about the signs and symptoms of lung cancer, especially if you are at higher risk due to smoking or other factors. Early detection can improve treatment outcomes. Attend screenings. If you are at high risk for lung cancer, such as current or former smokers aged 55, 80 with a significant smoking history, discuss the potential benefits and risks of lung cancer screening with your healthcare provider. Seek medical attention for symptoms. If you experience symptoms such as persistent cough, chest pain, difficulty breathing, coughing up blood, or unexplained weight loss, seek prompt medical evaluation. Follow your treatment plan. If you are diagnosed with lung cancer, work closely with your healthcare team to develop and follow a treatment plan tailored to your individual needs. This may include surgery, chemotherapy, radiation therapy, targeted therapy, immunotherapy, or a combination of these approaches. Don'ts. Don't smoke. If you don't smoke, avoid starting. And if you do smoke, make every effort to quit. Continuing to smoke will only further increase your risk of developing lung cancer and other health problems. Don't ignore symptoms. If you experience symptoms that could be indicative of lung cancer, such as persistent cough or chest pain, don't ignore them or assume they will go away on their own. Early detection and treatment can significantly improve outcomes. Don't delay seeking medical care. If you are at risk for lung cancer or have symptoms suggestive of the disease, don't delay seeking medical evaluation and appropriate testing. Early diagnosis and treatment can make a significant difference in prognosis and survival. Don't hesitate to ask questions. If you are diagnosed with lung cancer, don't hesitate to ask questions and seek clarification from your healthcare team about your diagnosis, treatment options, and any concerns you may have. It's essential to be informed and actively involved in your care. Don't isolate yourself. A lung cancer diagnosis can be challenging emotionally and mentally. Don't isolate yourself. Instead, seek support from friends, family, support groups, or mental health professionals who can provide emotional support and encouragement throughout your journey. Remember that every individual situation is unique, and these guidelines are meant to provide general advice. It's essential to consult with healthcare professionals for personalized recommendations and guidance tailored to your specific circumstances. Effects of lung cancer on the human body. Lung cancer can have significant effects on the human body, as it disrupts the normal functioning of the lungs and can spread to other organs. The effects of lung cancer depend on various factors, including the type of lung cancer, its stage, and whether it has spread to other parts of the body. Here are some common effects of lung cancer. Respiratory symptoms. Lung cancer often leads to respiratory symptoms due to the tumor obstructing the airways or interfering with lung function. Common respiratory symptoms include persistent cough, wheezing, shortness of breath, chest pain, and coughing up blood, hemoptysis. Decreased lung function. As lung cancer progresses, it can impair lung function, leading to decreased lung capacity and difficulty breathing. This can result in fatigue, weakness, and decreased tolerance for physical activity. Pleural effusion. Lung cancer can cause the accumulation of fluid in the pleural space surrounding the lungs, known as pleural effusion. This can cause chest pain, shortness of breath, and difficulty breathing. Metastasis. Lung cancer can spread, metastasize, to other parts of the body, such as the bones, liver, brain, or adrenal glands. Metastatic lung cancer can cause additional symptoms depending on the organs affected, such as bone pain, jaundice, yellowing of the skin and eyes, neurological symptoms, or hormonal imbalances. Weight loss and cachexia. Advanced lung cancer can lead to unintentional weight loss and cachexia, a wasting syndrome characterized by muscle loss, weakness, and fatigue. Cachexia can significantly impact quality of life and contribute to treatment-related complications. Paraneoplastic syndromes. Some types of lung cancer can produce hormones or other substances that cause paraneoplastic syndromes, which are symptoms unrelated to the direct effects of the tumor or its metastases. These syndromes can manifest as hormonal imbalances, neurological symptoms, or skin changes, among others. Immunosuppression. Lung cancer and its treatment can weaken the immune system, increasing the risk of infections and affecting the body's ability to fight off pathogens. Emotional and psychological impact. A diagnosis of lung cancer can have profound emotional and psychological effects on individuals and their loved ones. Anxiety, depression, fear, and uncertainty are common emotional responses to a lung cancer diagnosis, and supportive care is essential for addressing these issues. Pain. Lung cancer can cause pain, either due to the tumor pressing on surrounding tissues or as a result of metastasis to bones or other organs. Effective pain management is essential for maintaining quality of life for individuals with lung cancer. Fatigue. Fatigue is a common symptom of lung cancer and can be caused by the cancer itself, as well as by treatments such as chemotherapy, radiation therapy, and surgery. Overall, the effects of lung cancer on the human body can be varied and multifaceted, impacting physical, emotional, and psychological well-being. Early detection, timely treatment, and supportive care are essential for managing the effects of lung cancer and improving outcomes for individuals affected by this disease. Natural remedies, foods that can help lung cancer. It's important to clarify that while certain natural remedies and foods may have supportive roles in overall health and well-being, they are not a substitute for conventional medical treatments for lung cancer. Lung cancer requires prompt and appropriate medical intervention, which may include surgery, chemotherapy, radiation therapy, targeted therapy, immunotherapy, or a combination of these approaches. However, some natural remedies and dietary strategies may complement conventional treatments and support overall health during lung cancer treatment. Here are some examples. Nutrient-rich diet. Consuming a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats can provide essential nutrients, antioxidants, and phytochemicals that support overall health and may help strengthen the immune system. Aim to include a variety of colorful fruits and vegetables, such as berries, leafy greens, carrots, bell peppers, and cruciferous vegetables like broccoli and cauliflower. Omega-3 fatty acids. Foods rich in omega-3 fatty acids, such as fatty fish, salmon, mackerel, sardines, flax seeds, chia seeds, walnuts, and hemp seeds may have anti-inflammatory properties and support heart health. Including these foods in your diet may be beneficial for overall well-being. Turmeric. Curcumin, the active compound in turmeric, has anti-inflammatory and antioxidant properties. Some studies suggest that curcumin may have potential benefits for cancer prevention and treatment, including lung cancer. You can add turmeric to your diet by using it in cooking or taking turmeric supplements, but consult with your healthcare provider before starting any supplements, especially if undergoing cancer treatment. Green tea. Green tea contains polyphenols, such as epigallocatechin gallate, EGCG, which have antioxidant and anti-inflammatory properties. Some studies suggest that green tea consumption may be associated with a reduced risk of certain cancers, including lung cancer. Drinking green tea in moderation as part of a healthy diet may be beneficial. Probiotics. Probiotics are beneficial bacteria that can help support gut health and immune function. Consuming probiotic-rich foods such as yogurt, kefir, sauerkraut, kimchi, and kombucha may support overall health during cancer treatment. However, discuss probiotic use with your healthcare provider, especially if you have a compromised immune system. Hydration. Staying well hydrated is essential for overall health, especially during cancer treatment. Aim to drink plenty of water throughout the day to stay hydrated. It's crucial to consult with your healthcare provider before making any significant changes to your diet or incorporating supplements, especially if you are undergoing cancer treatment. They can provide personalized recommendations and ensure that dietary choices and supplements are safe and appropriate for your individual circumstances. Additionally, always follow the advice of your healthcare team regarding lung cancer treatment and management.